Hi everyone. As many of you know, your healthcare providers have been prescribing exercise for you to help you in your recovery from post-concussion syndrome. And so we're gonna go over how to kind of do your exercise. It sounds like a simple thing, but there are some things you can do. So first thing is, I wouldn't recommend that you exercise if you have a migraine or you have like a dizzy spell, like say from crystals in your inner ear or something like that. At that point, you might want to just take it easy and treat the issue. But otherwise, if things are relatively stable, one of the things you want to do is check in with yourself and see what your symptoms are. So say, for example, I have a 2 out of 10 headache right now, and I got a 2 out of 10 dizziness. So I'm going to document that on a journal. We'll show you the journal on our website that we use, that we recommend for our patients. Feel free to use it. And then what I'll do is I'll just go on to my exercise equipment here. So I have an elliptical machine here. Some other common ones that people use is stationary bicycling. That one is nice because if people have a lot of dizziness, it helps prevent aggravating the dizziness more than say jogging would. On the flip side, if you have a lot of neck issues, sometimes kind of holding your neck forward with cycling can kind of aggravate that. Elliptical is nice because it helps you recruit your core, because the machine does that, provided that you do it with your whole body. You know, you do it with your somatosensory, so you do it with your feet and your hips, and you feel it like with your whole body rather than just kind of doing this way, you know? Anyways, my point is so you start exercising, and say like 5-10 minutes in, I reach a steady clip. At that time, what I want to do is just take a pause and measure my heart rate the way we showed you in a previous video, or you may have a monitor. And then just document that. And then you just go up and you go back and finish your workout. We recommend generally for people at the beginning to start with a 5-minute warm-up, 5-minute cool down, and 20 minutes of a steady state. So in my prescription, the one that my treating team gave me, I was prescribed a heart rate of 120. So when I just measured my heart rate, it was 110. So I have to pick it up a bit. So I'm picking it up a bit. And then after a few minutes, when I feel like I've reached that steady state, I'm feeling a little bit more sweat, a little bit shorter of breath, then you just want to kind of measure it again. And if I'm a bit over, I want to kind of reduce my intensity. After a while, you're going to develop an intuition. You don't have to be so specific. But at the beginning, this helps you develop an awareness of how your exertion level correlates with your heart rate. And of course, at any time, if the symptoms get intolerable, you just stop and you can just record that. Otherwise, you just finish your workout. And at the end of the workout, you write down what your symptoms are. So I started with headache and dizziness of 2 out of 10. And now it's a 1 out of 10. It actually got better with this workout, and you write that down. Some other things you can do with your exercise. So some people who have like sensory integration problems, post-concussion, like say dizziness or something like that. One of the exercises you can do if you've been training mindfulness of how to of sensory integration, you can do the exercise with your eyes closed. And try to really feel the force and feel the stability that's provided to you by the ground, by the pedals, by your hips, the relative ease and relaxation in the superficial muscles, the engagement of your core. And you can always open your eyes and check and see the difference between eyes open and eyes closed. And internally, try to get them to tally so they feel the same. And you'll notice to do that, you really have to use more of your somatosensory system. So really engage more of your core. And some imagination and relaxation help too. I know it sounds kind of counterintuitive, relaxing while you're exercising. But many athletes have talked about just that. Floating like a butterfly, stinging like a bee. Water can flow, water can crash, that sort of thing. And that's basically it. So we're going to show you now how to kind of document everything in your journal.